can't do it. I can read all about it, which is why I'm in HIM. But to actually do it, I don't know. Someday I say I want to be a nurse when I grow up, but I'm pretty content doing what I'm doing now. I've been teaching at MCC now for almost 8 years, wrapping up my 8th or 9th year here. Again, so we're pretty much the backside of healthcare, and I can go into it a lot more in detail with questions, but that is me.
Thank you, Miss Allison. And then Janine, if you can go ahead and tell us a little bit about your experience, please.
Sure. Hi. Again, I'm Jeannie Burns. This is my 3rd college I've attended, or did just attend. I graduated from MCC in May, and I did take my certification exams. I became a certified coding specialist in June of this year and a registered health information technician in August. So I'm all set, ready to go. I started out actually working in a nursing home in the early 90s, and everything was, of course, paper. And so, of course, this is all new and exciting. And then I decided to go to college, went to ECC, did all of my gen eds there, and then went to NIU and graduated with a bachelor's in psychology and a bachelor's in criminology. So life happened, and I ended up going into a field completely unrelated to anything I studied. Worked there for 16 years, and it was not a very rewarding time in my life. I had a really freak accident at work, lost my job in 2015, and somebody happened to mention medical billing and coding. My mom had actually done that a few years back as well. She said, "You'd be really good at coding." So I thought, sure, why not? And I ended up at MCC, and that was all I was going to do, was medical billing and coding. Well, then I talked to Chris in the HIM department, and she put everything into place. And the next thing I knew, I was in the RHAT program. Fantastic, fantastic experience. Definitely challenging, very rewarding. And like Allison, I've always known that I wanted to do something with healthcare, but I can read about blood and guts, just can't do hands-on. So I figured this was the perfect fit for me. And that's it.
That is an awesome story. It's fun. It's very fun to hear everybody's like twists and turns for sure. Thank you for that. So now we heard from our HIM. Let's actually move over to PT and see what they have to say. So we can start with Angela. Angela Wallace, you want to start with that?
Okay, so I pray that it stays nice and calm here. Anyways, I'm Angela Wallace. I have been a physical therapist assistant for about 19 years. I went to school down in University of Indianapolis. So then at the same time, I pursued a master's degree in gerontology. And prior to that, I did a bachelor's in exercise science, which all led me to the ability to be able to teach at MCC. I have been at MCC. This is my 3rd year teaching as one of 2 faculty that teach at MCC. We also have adjunct faculty members that help teach. Even before I was at MCC, I heard somebody say ECC. ECC was where I did, or Elgin Community College was where I was doing some adjunct teaching, which also got my feet on the ground for teaching. And so therefore at McHenry County College, I'm in charge of the clinical education programming through our physical therapist assistant program. So that is my role. However, I do spend time teaching in our program, as well as at the moment teaching other classes.
This is so funny.
Oh, I'm sorry.
You're fine. Did I answer all the questions, Amanda?
You got it. Thank you very much, Angela. Thank you very much. Shannon, actually, if you don't mind, if you want to go ahead and speak next, please.
Sure. So I'm Shannon Guzik. I'm actually speaking as a person out in the field, not at MCC. However, I have taken clinical students, PTA clinical students, doing their internship under me for several years. now at MCC, but before that with Elgin Community College. So I've been a PT assistant for about 25 years. And I've done some inpatient work, some home health care, nursing home, and outpatient. And outpatient was really where I landed. I've been at my current outpatient facility for quite some years, over 10 years. I forget how many. I'm at Independence Health and Therapy, which is in Woodstock. And we treat both adults and children. Super fun. We see babies from 3 months old. And I think the oldest client I've treated is probably 98 or something like that. So we really do the whole age spectrum. I love being a PTA. I graduated from Oakton Community College in Des Plaines years ago. And always thought I'd go back and get a PT degree, but I've been so happy being a PTA. In the last couple of years, I took on the management position at my facility, which is kind of fun too, but I didn't want to give up patient care. So I do both management and patient care.
Thank you, Shannon, and is a terrific manager, if I may say so myself.
Thank you.
Thank you. I used to work at Independence Health with Miss Shannon, so.
Yeah, we miss you still.
I miss you guys. It's an awesome place. Thank you so much, Shannon.
Mm-hmm.
So now we're going to actually hear from Jenn, who is currently in our program. She's going to tell us a little bit more about that.
Hi, everybody. I recognize a few names and faces up there. So my name is Jenn Cunningham. I am, like Amanda said, a student in the PTA program. We are the first class going through, due to graduate in December, which is exciting. Kind of along the lines of what Jeannie said, I am a very untraditional, non-traditional student, but many of us at MCC are. So my background is, was in medicine. So I graduated back many years ago with a bachelor's in biology. I actually then went to medical school. And when I was leaving medical school, I wanted to do physical medicine and rehab. And similar to Jeannie, life happened. I had my son in my last year of school. So I did finish and graduate. I never did my residency. So I ended up being a stay-at-home mom for about 14 years. And then knew something was missing, wanted to get, back into working. It was financially necessary. It was something I desired for myself too. So MCC is kind of, in my backyard, and I looked into taking some classes. I actually started down the path of nursing. I started taking prereqs for the nursing program, and I was just about done, and I was kind of unsure about that decision. And so one of my instructors was like, have you ever thought about, PT or OT? And I said, no, not really. So I discussed, I, at that point, had met Dr. Kristen Lauderman, who is the chair of the PTA program, sat down with her and talked, and we kind of, it just piqued my interest and really intrigued me to what I had wanted to do back before when I was in medical school. And so it just, it sunk in my brain. And interestingly enough, Angela and I went to high school together. And so I called her up and knew she was a PTA, and I was like, hey, tell me about what you do. So that was kind of fun too. And it was kind of at the point where she was, making her transition to NCC. It just all kind of fell into place, but it's been great so far. We've had some challenges being the first program and, with what's going on in the country at this point, but it's good. It's all, everything has been great so far.
Thank you so much, Jenn. And for anyone in our audience too, of course, I'm sure that's what Jenn was saying too. When you're like, hey, there's some of you. Definitely, as a little plug for Bio Open Lab with the SAGE Center, you want to see Jenn, you can see her on Zoom and you can see her live. So if you're in anatomy and physiology classes or any of our bio classes too, you can, of course, access Jenn that way as well as get additional information. So you don't want to miss that, for sure. Just a little plug there. Thank you so much, Jenn. And then Ashley, if you want to talk to us next, she is from Smith PT and Running Academy. Thank you so much. If you want to just give us a little information about yourself and how you've come to get into your field and stuff. Thanks, Ashley.
Yeah, hi. Sorry for getting on late. I was just finishing with a patient. So a little bit about myself. I work at Smith Physical Therapy. I'm a physical therapist here, and I've been with this team for about a little over a year and a half or so. And so I started my physical therapy career in 2011. I graduated from Northwestern for grad school in their doctorate program, and my undergrad was at Marquette. And so I started with a kind of big company, outpatient ortho, and I really enjoy that experience. But I love what we're doing here. It's a little bit different. I'm loving kind of the one-on-one I get with the patients for an hour, which is part of what led me to pick physical therapy. I really love treating the whole person, and that includes not just the physical side of things, but also mental side, emotional side, and really getting to know the patient as a whole. I just feel like patients do better when you can give them that kind of personalized care. So I treat everything from the toes up, as I like to say, but I specialize a bit with our running program and looking at running. And then I also recently have started doing women's health. Again, not something I was necessarily interested in a while back, but have started to really just enjoy helping women kind of on their journey. So that's where I'm at now.
Thank you so much, Ashley. You guys are just, it's so fun to hear everyone's story. Thank you so much. Appreciate that.
Yeah.
For being with us.
Yeah.
It's always exciting. Like I say, we have a nice representation of everybody here, guys. So now we can look into our CNA and RN programs. So Angela, if you wouldn't mind going ahead and giving us some information about that, please.
Sure. My name is Angela Sass. I am one of the nursing instructors for our associate degree nursing program. As far as BNA goes, or the basic nursing assistant program, it is a 1 semester course, which is also a prerequisite to the nursing program. I have taught in that course as far as clinical goes, so I can answer questions regarding that course. And then as far as the nursing program goes, or kind of my history, I've been a nurse for 20 some years. Yeah, just over 20 years. I have my doctorate. I have been a manager in the clinical setting, an educator in the clinical setting. And then back in 2007, I started at MCC and started the nursing program here. So I've been here the whole time. So I should be well versed in it. And I think that's about it.
Thank you so much. Yeah, that's a very helpful background too. Thank you. Very neat. And then Jess, if you wouldn't mind sharing a little bit about your experience as well with the nursing program, please.
So I am Jess Modjewski. I actually graduated last year from the nursing program at MCC. I've been in healthcare for 10 years, started way back in the day as a CNA. Never really had any intentions of working as a CNA. I kind of just wanted to skim on through nursing school, but just as everybody else has, life happened, and 3 kids later, and 10 years later, I finally made it to nursing school. I also worked as a certified medical assistant for 3 years. I did that certification kind of in the interim between children. Currently, I work at St. Joe's Hospital in Elgin. I am a full nurse, which means I've been trained in every department in the hospital, anywhere from med-surg to ER to ICU. And then I also just started my BSN in August, which is a little crazy to kind of jump back into school, but I think I've got a kind of a good groove going, and I am doing an online program through University of Northern Michigan University to finish my BSN, and then I am also doing a minor in applied workplace leadership with the intention on possibly doing nursing leadership or education in the future.
So you're just a little bit busy.
I like to be busy.
Well, you're doing a good job at that. Wow, so cool. Thank you so much. Thank you very much. So now we can move to, Miss Betsy is on as well. Betsy, totally up to you if you want to share some of your experience or if you'd rather not.
I'm just here for moral support if you guys have any extra questions. But so I'm Becky Smith. I'm the director of nursing, and then I oversee the CNA program, or BNA. I feel like we have so many acronyms for that one, the nursing assistant. So I'm just here. Thank you all for coming. It's nice to see you all. And yes, reach out if you have any questions.
Thank you so much, Betsy. So then I guess we will move on to OT. So if we can start, why don't we start with Becky for our OTA program?
Hi everyone, I'm Becky Smith. I'm one of the faculty members over at MCC in the OTA program. I have been an OT for 19 years and worked in a variety of different settings. I started out in the school system and then moved to a skilled nursing facility. I did some home health for several years, acute care in the hospital, and also outpatient neuro. So a little bit of everything, which I really like about the degree is that you can kind of move around. What else was I going to say? Oh, I'm still working in the hospital. I work for Northwestern in acute care on some weekend shifts and picking up some vacations and stuff like that. So I still am out there in the clinic. So that's just a little bit about me.
Thank you so much. How about Miss Traci?
Hi everyone. My name is Traci Gerner. I'm an occupational therapist. I've been an occupational therapist for 23 years. When I graduated, eons ago, you only needed your bachelor's degree to be an OTR. So that's what I graduated with 23 years ago. I spent a year in acute care. And then I practiced an additional about 10 years in school-based practice and then went back and got my master's degree. I've continued to practice in school-based pediatrics. That's where my specialty lies. I have done teaching. I taught at MCC for about 4 years. I now am in Arkansas. We've moved for my husband's position. And where we live right on the border. So I actually also teach in an OTA program in Missouri at Crowder College. And then I also, the University of Arkansas just admitted their first OTD program. And so I'm doing some consulting with them as they're getting up and going. So that's been fun. The other change when we moved here 4 years ago, I started working for a teletherapy company, way before the pandemic, and everybody is on doing remote things right now. So I've been doing it for 4 years. I'm a lead at the teletherapy company that I work for. And I absolutely love working, and I'm working with students in the school-based setting all through teletherapy. So I spend my day right here in my office at my house, treating students all day long. So that's kind of my background. I've been all over, we've moved all over. Again, one of the benefits I think of this position is I've had the flexibility to move and always be able to find work, because it doesn't matter what state I'm in, there's always been a need for OTs.
That's very, very cool, Traci. And you definitely you've definitely worked the spectrum too. Thank you so much. And then Jessica, if you can please share some of your story and some of your educational experience and stuff too.
Hi, my name is Jessica Traci. I graduated the program at MCC in 2017. I studied for a little bit. I got my certification and applied to different places, and I moved in Tennessee. So if it gets too dark, let me know. I'll turn the lights on in my car because my house is a mess. Kids running around, and we're doing floors and everything. So let me know if I need to turn a light on. Let's see. I left the military, went to MCC, knew I wanted to do OT because while I was in the Marine Corps, I took a kinesiology course, which introduced me to PT and sports med and the gym trainers, and I found OT and I realized that's what I wanted to do. So I went to school, I graduated, got certified, moved, and I currently work at a long-term skilled nursing facility that is also a skilled nursing facility that is also an outpatient clinic. And so we have a lot of different things going on. Currently, our youngest patient is 27. Our youngest patient is 27. Our oldest patient is 104. 5, and I see everything from strokes to traumatic brain injuries to falls, lots of falls, and just people who have a hard time living on their own. Oh, and we also have a locked unit, which has our dementia care, who are people who are wanderers who really like to escape. We call them our Houdinis. So.
Neat. Thank you so much for that as well. Thank you very much. So we definitely have a lot of different stories that we got to hear. Megan, did you have any questions for the panelists that were coming in, or?
Not yet. So if you do have questions, feel free to throw them in the chat. We can get those answered. So Amanda, if you want to start with any of the ones that you had, and then once we get some student ones in, I'll ask those.
Most definitely. What would you guys say? How has the field, for those of you who have been in the field for, 5 years or so, what would you say have been the biggest changes in the last 5 years? And do you have any predictions of changes that are going to be occurring in the next 5 to 10 years? And for those of you that are newly graduated or in school, even anything, maybe that you've heard about too, feel free, of course, to share.
I'm going to jump in here really quick. Our biggest changes in HIM, which the reason why I wanted to answer, because I know everyone else can talk about it as well, but we had the change of diagnostic codes. So we went from ICD-9 CM to ICD-10 CM and ICD-10 PCS, which has completely changed the way we code and the way all of you guys document. So that was a huge change. We've also in the past 5 years seen a tremendous change to the electronic health record, right? We all went from documenting on paper and filing paper to now we have an EHR, and we've all had to be trained on them and kind of change the way everyone worked from, again, from my area to everyone else, from the PTs, the OTs, and the nurses. So those are the biggest changes we've gone through. But again, they're changes that every single one of you guys have gone through as well.
Thank you, Miss Allison. Anyone else want to chime in from our panel on changes that you guys have seen? Or is it kind of what else?
Sure. Sorry. Hi. This is Ashley again. I was just going to say, I guess some of the changes, so I've been treating for about 11 years. It's hard to keep track sometimes, but I would say a big shift to direct access for physical therapy and being able to come without a script. And then I guess where I forecast kind of things continuing to trend or change is sort of a shift away from modalities and a shift towards more overall wellness and prevention. Just within our own field is kind of where I'm seeing things trend.
Thank you for that. Anyone else? You guys definitely did a nice covering, like you say. See, and that was like what we were saying in the beginning too, how there's so much overlap between the fields. So kind of what someone says in one field, definitely, of course, it's going to be universal with the different health professions. So another question I would think, let me choose from my fine list. What would you recommend people do when applying for the programs at our college? Sorry, let me specify for HIM, for RN, for our, the programs that we're talking about right here.
Becky, take it over. I know you want to say that.
I would say no matter which program you're looking at or career path that you want to choose, before you even apply, I would say get out there and do some observation. Talk to people. Make sure this is what you want to do with your career and your life. You've got to have a passion for it, no matter which way you go, but really get out there and get a good feel for what that is. If you can observe, go for it. So I'm going to start with that before you even apply.
That is excellent advice, most definitely. And that is actually something that I would say is pretty neat as well, because if you observe in, any of the settings, in outpatient settings, skilled nursing, hospital,
you're going to see the overlap. You're going to see what nurses are doing. You're going to get, of course, a taste of what people in HIM do, because you would see the therapist having to code everything, as well as PT and OT. So you might be there thinking, hey, I want to observe, physical therapy. And then all of a sudden, hey, what are they doing? And become completely intrigued. So you definitely, that is excellent, Becky. Is there anything that you guys would say as far as applicants being maybe more stand out a little bit? Is there anything in particular? Or do you guys look for anything in particular as far as job experience, volunteer experience, whatever the spectrum might be on that? I think anytime you can shadow, do those shadowing hours, which I know is really tough right now. I know we're in a situation where shadowing, that might not be an option, but I think you come with a whole different level of knowledge when you go to that application process. If your program has an interview, you have something to speak to then, if you've shadowed or if you've observed. And one of the suggestions, one of the things I'm seeing with my own college students that are going into medical careers is they're really starting to shift and do some stuff with like Facebook groups. They're connecting to other clinicians. They're connecting to other people in the field because they can't go in and do the shadowing right now. So I would encourage you to take a look at different Facebook groups, join different Facebook groups, and at least be having those conversations. I know there's groups that are putting together videos that they can watch. It's not the same thing, and I get that, but at least it's something right now while we're, hopefully getting ourselves through this pandemic and then out so that you can get back out and shadowing. But in the meantime, it might be a way to continue to pursue fields where you can't get into the physical buildings right now.
Yeah, I agree, Tracy. And Kyle, I saw that cute little dog on your screen. He was cute. He can stay. Hey, dog. Another thing I want to say too is come and, shadow, absolutely. Once you realize this is something you want to do, come and speak to a faculty member, right? Whether it's, even if it's the director of the program or a dean, come and talk to us and give us just chit chat with us. We're going to let you know what the prereqs are, what, how to go about laying the schooling out for you, what classes to take, when to take them. So that's a huge thing. And even, speak to a student in the program or a graduate. We as the faculty can always hook you up with somebody who's going to be willing and wanting to talk about their experience with you guys.
That's excellent advice.
I would just like to add something too. As having not really had any experience in the medical field since the early 90s and so many different changes, when I did decide to go back to school, I was focused completely on the medical billing and coding, and that was it. I had nothing else was in mind. And when the HIM program was brought up to me, I still really didn't know what it meant, because there are so many different opportunities within that field where you can do so many different things. And so not only do I recommend reaching out to the HIM department and possibly former students and everything, but do your research. There's so much on the internet about what you can do within the HIM program that I did not realize until I sat in one of Allison's classes, and she just went, and it was like major overload in my brain. And I'm going, I want to do that. 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 I don't want to do that. Definitely not that. So it can be pretty overwhelming, but if you do your research, it's out there for you to find.
Neat. Thank you so much for that. Anyone else?
I had a quick comment. I know a lot of you guys mentioned observing shadowing, which isn't possible right now. But if anybody is interested in PT, one of the things that I don't know if I would say regret, but that a lot of my classmates and I guess classmates in the first year group have done is a lot of them are actually techs somewhere. And so that's still something that you can do. I mean, you may already have another job, but if you're looking for something to do as far as getting in and seeing the field and talking to PTs and other PTAs, that's definitely something that I would, recommend as a possibility, because you can do that. A lot of places won't let you shadow, but you can get a job, so.
Great idea, and get some extra money.
Right?
Perk. Anyone else from the panel on that?
I was actually going to add, kind of tack on to what Jen just said. From a nursing standpoint, as a CNA, there's actually, you don't necessarily just have to be working on the floor or, working in the nursing home. There are various roles throughout the hospital that require you to be certified, but not necessarily doing direct patient care. So there are CNAs that work in surgery as either transport techs or unit clerks, or they take care of patients in recovery. Even in the emergency room, they have CNAs that work down there to start IVs, they do EKGs. So there are specialized things that we can do just beyond the normal, like ADLs and cares and that kind of stuff. So, I mean, I worked as a CNA, was a CNA for 10 years. I feel that every bit of experience you get is going to only make you a better caregiver in the future. So take advantage of any role that you could possibly get if it's offered to you.
So true. Anyone else from the panel? We have been a couple of questions. Of course, guys, feel free to circle back, at any time if you're like, hey, I wanted to add that. So one of the questions we have for the OTA program, due to COVID-19, how are the classes for the OTA program? How are they going to be? Would it be through online or blended?
Right now, we have, for the OTA program, we have one class that is online. It's more of a theory class, it's not really theory, it's more like the different diagnoses that are out there, like what is the difference between multiple sclerosis and Parkinson's and ALS. But then the rest of the classes are actually in person. For the spring, we are planning right now, if everything is okay, we're planning to have the rest of our classes in person. So if we're able to, we definitely want to have it in person because there is a lot of hands-on. So if we can get you in there and get the hands-on, that is what we want for our students.
Thank you, Miss Becky. And actually, is that something too, Angela and Allison. Allison, you guys, if you don't mind, if you maybe all want to kind of speak to that a little bit too, just in case there's other people from other.
I'll say that the PTA program, we are also doing classes face-to-face on campus. In the spring, obviously, we all went online and we kind of weaned ourselves back in during the summer, and now we are face-to-face.
Same here for the associate degree nursing program. We've done a few like somewhat blended courses, but primarily it is face-to-face, and we are in the hospitals doing clinicals. So
HIM is very different. Our program was developed in 2015, I'm sorry. And the way we went about developing it was for a non-traditional student. We see a lot of non-traditional students in our program. So we work on a blended schedule. All our classes are either online or blended. Our blended schedule meets 1 to 2 times a month. And then that is in person. Right now we are having those in-person meetings. Thankfully we've been capable of doing that. So that is how we have always run our program. It works well. Typically we have stay-at-home moms who are coming in, or who I have students just like Jeannie, right? Who they've stayed home, and raised their kids, or, they worked and things have changed. And so they're looking to work at the same time as coming to school. So we've always tried our best to work with that student, with that non-traditional student schedule.
That's very nice and flexible. I'm sure that would be, in an ideal world, that would be awesome to be able to do for all of our programs, right, guys? Thank you so much for that. So we have a couple more questions as well. Let's see. My scroller doesn't want to scroll. Here we go. I won't be finished with my prerequisites until the end of spring 2021 semester for OTA. Am I still able to apply to the program this spring? I heard the applications are only accepted in spring. And that was for OTA.
Okay, actually the applications are, we accept the applications by August 15th. So the cohort that would be starting this spring they've already done the application process. So if you are finishing your prerequisites in the spring, you'll actually be applying for August 15th and then starting the following January.
Thank you, Ms. Becky.
Yep.
And for PT and nursing, do you guys actually mind letting us know too when the deadlines are?
Go ahead, Ange.
So our program has shifted to a fall start. We just had our applications due because originally it was a January start. We just had applications due for the first round of students that applied. We still have a second deadline, and I want to say it's in April, but I can't remember that date off the top of my head. I apologize. So that group, when that group of students is selected, they will then start in the fall.
And then for the registered nurse program, right now we're a once-a-year admission. So we accept applications March 15th, but you have until the end of that summer. So if you're applying for fall 2021, you have through summer 2021 to finish all your prereqs. I wouldn't suggest waiting till summer, but if you had like one class left or something, we do allow you to still start if you had that one class, to take that one class in the summer. But once you start the nursing program, all the prereqs have to be finished by the time that you start the nursing program.
Thank you guys very much.
Amanda, can I say one thing?
Yeah, please.
Sorry. So some of our students also start the program without all of their prereqs done. It's suggested, it's recommended and encouraged to have the prereqs done as much as possible because the program is pretty intensive. However, if you don't have them all done, we have had students complete some of the classes while they're in the very beginning of the program.
Thank you for that. Okay, that's a nice piece too, a little bit of flexibility with that. For nursing, for the TEAS test, is that due at the application deadline as well, I'm assuming?
Yes, it is due. So in the testing center, we host the TEAS exam twice a year. So at the beginning of fall and at the beginning of spring. So look for those dates to be posted. Typically for the spring, they're posted in November, and then the students need to register sometime in December. The spring dates fill up the fastest because, of course, that's when it's closest to the application date. And so when it says like the registration opens December 9th at 9 a.m., get on it and on the 9th at 9 a.m. Because they do fill fast. And then for the summer, or for the fall dates, they're probably up there in June, July. We tell students to strive for a total score of 70. So please study for it. Even if you think you are just a really wise person, study for it. There's study material in the MCC bookstore, or you can go onto ATI's website.
Thank you, Betsy.
You're welcome.
Another question came in for PT. And the question, so if you guys want to answer, what was your PT school experience like?
I'll go. For PT school, I went to Northwestern, and so at the time it was semesters, and it shifted a little bit. It was a bigger PT school. It's still bigger. So I think we had 75 in our class. I think most are more within like the 30 to 50 range. But I would say it was a fantastic experience. I think the lab components are huge. I just recommended to a student recently, I think labs are an area where if you're really tired that day, you sort of zone out. And I was telling the student that we have right now the importance of really trying to maximize your time in lab. So I would say that's like a good takeaway if you're trying to learn from that. But I had a fantastic experience. Our program was accelerated. So at the time it was 2.5 years. Most doctorate programs are 3. And you know, it was just a lot of material and it's a lot of work, but I would say it was a fantastic experience, and I would recommend the program to other people as well.
Thank you, Ashley. How about Shannon, Angela, Jen?
Sure. All right. So I loved PTA school. It was great. Like I said, I went to Oakton Community College, and it was a 2-year program, but I had taken my prerequisites already. So I actually probably did go 4 years, all told. But I took a lot of other fun classes too that weren't required, just because I love to learn. But once I got into the program, because I had my prerequisites done, I was able to still work part-time, which is good. And I was able to work as a PT tech. That was just super fun. I worked in actually a home for disabled adults. So it really got my my feet wet, my hands dirty in actual patients that are different, that really have a lot of large needs. So I loved the fact that I could work part-time doing that. But school was super intense. I slept and, ate and breathed all of the materials, because I think you've just got to do that, no matter what the degree is. You just have to immerse yourself into it, and it becomes like your world for those 2 years.
Thank you, Shannon.
I would say PTA school, after having gone to my bachelor's program, I learned what intense was. I learned, the program I went to was every Tuesday, Thursday night. I can't even remember how many hours it was. It was a while ago. But anyways, it was an intensive program. And so I would, at one point in time, work during the day, or also at one point in time, I did grad school during the day. And then I'd drive an hour to the PTA program. Interestingly enough, I went to a school that also had a PT program. So there was a lot of collaboration there, right there on site. So that was a neat part about it. And then when we went to clinicals anywhere they put us. So therefore, some clinicals were down in Southern Indiana, some clinicals were on the south side of Chicago. So I got a good, well-rounded experience. And that is usually the plan that we have for all of our students that go through the McHenry County College program. However, during COVID right now, we are doing what we can to get everybody into clinicals.
Thank you, Angela. And Jen, do you care to share what your experience has been like?
Well, it's funny because everybody else that spoke for PT is out of school. So their opinion is very different than mine, I'm sure. Still in the thick of it. But no, overall, it's been a good experience. MCC is a great place, obviously. I mean, if you're here now, it's such a great atmosphere. Everybody is so welcoming. I mean, I've had the chance to meet so many amazing, instructors, people from other departments, other students. Jess and I had a class together. Actually, we took anatomy together. I've had, just overall a great experience. It's definitely tough. It's not for the weak-minded, but it's doable. I mean, even as a non-traditional student, I have 2 teenagers. I work 2 jobs. It's doable. It's not easy, but they're going to get you through no matter what. The instructors are, everybody is there for you. Everybody is supportive. There's tutoring. There's help when you need it. So it's, I guess it's definitely doable. That's the bottom line.
Thank you. Yeah, I did the OTA program, and like you guys were all saying, you definitely immerse yourself in the program, and kind of like what Shannon was saying, you definitely learn. Mrs. Vogt, the director of the Occupational Therapy Assistant Program, always teases me because any of my other educational experiences, I did my Occupational Therapy Assistant last. And that definitely is the one that kicked my butt. So yeah, it's wonderful, but in a good way. You learn a lot of really great information. And, it's things that, of course, you guys are interested in no matter what program it is you're going into. So it's fantastic. You get to really learn a lot, but you'll be committed to it, which is great. That's what you're doing, right? So it's exciting. And then when you get to the working world, I always say, then things just seem easier. You don't know what to do with that free time. We have another question for OTA. For the OTA program, how can someone apply? So where do they find the application, that type of information?
That is all online. And I can post that in the chat. I can post that link in the chat. How's that?
Yeah.
Did you guys hear that? I'm sorry.
Oh, that's okay, Becky.
That's okay. No, I'll post the link in the chat box. But there is a website through MCC. We do have an OTA program website. It's got all the information on there, the dates, the application process, and everything from there. I know we are going to be doing a virtual information session in the future, and that will, once we have those dates, that will be put on that website as well. So I'll link you guys to that. I'll put that up in the chat box.
And I did want to put a plug. So nursing's applications, it's up there too, so you could see all the stuff that is required. But I am working on trying to make it electronic, so it's a little bit easier, especially right now with COVID. PTA right now is electronic. And also do know that HIM, they don't require applications. Woo! So that is a difference in their program. So, but PTA, OTA, and nursing are all application based, and ours is just like, just go onto the website, go mchenry.edu and type in nursing, HIM, PTA, OTA, and it'll tell you all the guidelines and like what we look at for application criteria.
Thank you so much, guys. Another question for PTA. What are some of the clinical locations for PTA?
So the clinical sites that we have are hospital-based, skilled nursing home-based, school-based, a lot of outpatient clinics. That pretty much sums up. Try to get a well-rounded experience, whether you want to work with pediatrics, whether you want to work with older adults. So I really try to take into consideration what your area of interest is, at the same time trying to get you other experiences that aren't exactly your number one idea. It's interesting when people think they don't want to do something and then they go do it and they come out of it with a much different experience. Like we just recently had students go from really being aware of what outpatient is to being inpatient and actually really liking it in the end. So that's kind of a nice piece.
Yeah, you sometimes are very much surprised, right?
To tag on to that, I always tell my students, they'll go to, whether it's the OR, endoscopy, some specialty area. And if they don't like it, I'm like, that's great. And they're, now you don't want to apply for that position, because especially, as people have mentioned, there's so many opportunities as far as employment locations, and it's hard being a new grad, not knowing exactly what that job would entail in comparison. So in clinical, if you can find things you don't like, that's just as valuable in your long-term career choices as finding something that you have a passion for, because at least you can rule out that as far as, I would hate for somebody to apply for a job, get it, and then be miserable for a year looking for something else. So the experiences that may not be your favorite are just as valuable to learn, what kind of position you are looking for.
Yeah, so true, right? It can knock it off the board. Thank you, guys.
Can I just tag on to that real quick?
Yeah, please, guys.
So the question just asked about clinical sites, and I don't know, it was kind of broad, but as far as distance wise, because a lot of people are concerned about that, we have sites, Angela can attest to sites, but I'm currently, the site that I'm at is 15 minutes away from my house, but my very first clinical was a little over an hour and 10 minutes. So I think that's our furthest site right now, but so a lot of local, probably I would say within 20 minutes.
I would say so too, except for we've had some special placements down in Indianapolis and Tennessee. So special request.
Great points as well. When you guys say that, do you mind OT and nursing? Do you guys mind also maybe speaking to that, where our clinical sites usually are too for those other programs?
I'll jump in first, I guess. So for the last semester of the OTA program, you spend 18 weeks of clinicals, or what we call field work. So we just have a different term for it. But in our program, we do an adult-based clinical first. So you'd have your 9 weeks in an adult-based place. And a lot of those are skilled nursing facilities, hospitals. Those are kind of the main areas. We've had a couple outpatient clinics. We've had a couple go to hands clinics. This year, we also worked with Independence Health and Therapy and did more community-based with an adult day program. So that's kind of the first one. And then the second one we do is a pediatric, because we also want our students to have a well-rounded adult through pediatric experience. So with the pediatric, the main places for that are schools. So a lot of our students go to schools. We tend to try to keep everybody based on where you live. I mean, we have students that come from DeKalb. So if you come from DeKalb, we're going to try to find placements down at DeKalb. Or if you come from Rockford, we're going to try to get you closer to Rockford. We do try to keep you as close as possible. I will say with the current pandemic, we've had to kind of spread our wings a little bit farther, but the students do know what's going on, and we give them the option like, hey, we've got a placement, but it's going to be an hour drive or such. So hopefully as things calm down, we can bring it back a little bit closer to home.
And then for nursing, we are primarily at the Northwestern locations, both McHenry and Huntley. We do go as far as west as St. Anthony's in Rockford, and as far south as Sherman Hospital in Elgin.
Thank you, guys.
We HIM, Amanda, I don't mean to cut you off. I'm so sorry.
No, please, Allison, please.
We do an internship as well. We just, and it's an internship. It's not obviously not a clinical. And we have locations, inpatient, outpatient, and hospice locations. So it is a requirement for our graduates to their last semester. It is a part of their requirement to graduate.
And how long is that internship, Allison?
It is 15 weeks, so it's the entire semester.
Amanda, you're muted.
Thank you. Sorry, I muted myself when I was scrolling. You guys, everyone, we're playing charades. So for someone who is interested in the nursing program, how do you recommend us go about finding shadowing or observing?
I think the most valuable part would be to, as Jess mentioned, probably getting a job as a tech. It's going to be, Northwestern used to allow shadowing. I don't know that they do right now because of the COVID, but they're also, I think, probably getting a job, and honestly, getting a job in the working environment, wherever you decide that is very valuable in the sense of time management. You're already learning skills that will be valuable to you in the nursing program. So students who come into the nursing program with absolutely no experience, really, there's some extra challenges as far as the language goes, health language or medical language jargon is, a huge learning curve in that first semester. I'm sure it is in all these programs as well. Having been in it for 20 years, I don't remember having to learn it exactly, but if you are in the work environment, then learning how a hospital works or how to move patients and things like that is very valuable. We can, it's worth calling. I know that they do some shadowing, especially with Huntley High School, that they're allowing some shadowing through their, I don't think it's called pre-med program, but they have like a healthcare academy, something like that. And I do think they are allowing some shadowing, but you'd have to call Northwestern to see if that's permissible at this time.
Thank you very much for that. And Allison, is there anything that you would recommend to students who are interested in HIM in order to get exposure? As far as like, are they able to do any kind of shadowing or any kind of job type of thing that they could do in order to get their feet wet a little bit more in the field?
Yeah, absolutely. You can do job shadow, right? It's a lot easier for us to job shadow as we are typically not on the floor with patients. We're all behind the scenes. Obviously, HIPAA does come into play to seeing patient medical records, but it is a lot less for us in regard to being able to shadow for students. But, I'm going to give that question to Jeannie. I think she may better be able to answer that as a past student.
Oh, good question. Yeah, really good question, Allison. Well, one of the opportunities that I've come across and I'm hoping to take advantage of that is that one of the great things about the HM department, it doesn't end when you graduate from MCC. And I've been in touch with Allison and Chris and everything, and they present us with opportunities for volunteering even. If, right now with the COVID for every department, it is a difficult time, unfortunately, to find a job. But in the meantime, you want to keep active. Obviously, you still have everything you need to do and keep up to date on all the changes that are always occurring. But there are so many different, boy, Allison.
I know.
But there are opportunities for volunteering. The internship that I did do, unfortunately, it happened, my semester, of course, is right when COVID shut down. So that was really kind of stinky. I only got a couple weeks and months, maybe. No, wait, when was that? March. So we started January. But that, of course, in itself is just valuable in itself. And then you develop the relationships with people. And so you can reach out to people. But really a big thing for me, honestly, is I take care of my elderly parents. My father passed away last year while I was in school, but I still take care of my mother and an adult son who has Crohn's. And I observe, just being on that side of the healthcare, I observe everything. So I'm paying attention, like my son just needed a release of information. And I know what that means now. And I can watch and observe just that end of it. And quite honestly, there are sometimes people didn't know quite what to do. And I'm like, I know the answer to that. That's about all I can kind of say at this point is you just observe no matter what in everyday life. When you're out going to the doctor yourself, you're kind of indirectly shadowing, as an HIM.
And I'll piggyback off that too. Our accrediting agency has a wonderful online presence with different groups. We have a HEMA Engage, which is a group for, current people working in the field, educators and students. And I recommend that to almost every student because it's a great place to go and do a sponsorship, right? So you're getting sponsored by somebody who's out in the field. And again, one thing with healthcare, I know 100% in my field is it's networking, right? It's who we know. We all get to know each other here in the field. They seem like huge fields, but in reality, they are all really kind of small. We all know somebody who knows somebody who's in it, especially within this area. Anytime, my son gets a new OT, my first person is Becky and Traci. I'm like, do you know this person? So that's one thing to keep in mind too, is it's about who you know. Make friendships, make relationships, be nice to everybody, no matter where you are, down to the janitor that's working at that hospital. You never know. One of the CEOs of Central DuPage Hospital started there as a janitor. So again, network, be nice, that's really is what it's all about.
I have to jump onto that one after Allison said that. So not only be nice, but if it's a position that you're not loving, even if it's a fieldwork position that you already have made up your mind, I don't want to work in pediatrics or I don't want to work in a skilled nursing facility, leave there with grace because like Allison said, it's smaller than you might think. And people know each other in the profession. So you always want to leave wherever you're at on good terms, because someday that person could be your boss in another facility, or that you could be looking for a recommendation, or they could know the boss in the next facility that you're trying to get a position at. So just always not only be nice, but be conscious of your attitude and your behaviors. You want to leave respectfully always.
Absolutely. And I always tell my students too, you know, I don't know how long, you know, I was in the field forever. All of us came from the field. You know, I don't know how long I'll be in education. Maybe I'll go back in the field. My student may be my boss someday. So, hire me, right? I helped you, hire me. But again, it's that networking thing, you know? I mean, it's a small world out there.
So true. Yeah, it's funny how small the world can be. Another question that came in for the OTA program. How can someone be prepared for the interview? Is there going to be an interview in general? So kind of what can they expect? What should they do?
We do an interview for the OTA application process. And the thing I would say with the interview is it is a group interview. So it's not like a one-on-one. It's you need to be professional, you need to be prepared, but it's not that like one-on-one where we're going to just grill you. It's a group of people. And just, you know, I think a lot of it is we want to learn about you as a person and what is your motivations and what has brought you to this point in your journey. So I say those are probably the biggest things we're really looking for in that interview.
Thank you, Ms. Becky. And for Jessica, did you have to interview?
I did not. I was one of the luckiest cohorts. I was the last cohort to not be interviewed. But I did sit in on a few of them. And I think the biggest thing that we saw was there's a give and take. You're trying to represent yourself, but then at the same time, our job is not something that is about yourself. So you have to be able to express yourself, but then still be there for the other people that are in the room. Let them get in there, let them talk about stuff. And if you have something in common, like be like, hey, you know, that's really cool, but not overwhelm yourself to where you're almost the only person in the interview. So.
Good advice on that too. Does PTA and RN, you guys do not do interviews, correct?
We do an interview process as well. We just finished up with interviews for the application round we just had. This time it was done on Zoom, so it was also a group interview, but in the past they've been group interviews on campus.
Nursing does not have interviews.
You guys. Another question came in for physical therapists here. So what are your favorite things about becoming a physical therapist? And like, you know, Jen, from what you've gotten to experience so far too.
I don't mind speaking, but I'm trying to
Go ahead, you go first.
Okay, so for me, being a PTA over all the years, I've had the chance to work in a variety of settings. I first started off at an inpatient hospital, and I got to see all the different levels of care, because at that point in time, they had you rotate through all the different levels of care, and didn't have you stay in one area. So that was the best thing that could have happened to me, because when I moved to Illinois and looked for a job, I was it was easy for me to get a job because I had all that experience. I have also done outpatient for a while. I've done a little bit of home health. I have helped out in nursing homes just to get that experience. Since I knew I wanted to go into education, I wanted to get a good idea. I've seen pediatric patients at our outpatient clinic. However, I do not specialize in treating children. I have 6 of my own. So I will say, in part to that, this has also been a great mom job over the years. And with physical therapy, I've gotten the opportunity to present to many different PTA programs as well, just to kind of, you know, it's been a rewarding career to be able to get out there and advocate for the physical therapist assistant.
Thank you, Angela. Jen, did you want to say something?
Sure, but can you repeat what the question was? Because I don't want to go off topic.
Absolutely. So what are your favorite things about becoming a physical therapist, and then, you know, for you, like your experiences so far?
So I guess one of my favorite parts, I mean, as Amanda mentioned earlier, I am a tutor in the biology department. I love anatomy. I am a pretty big anatomy nerd. So being in the physical therapist assistant program has, I guess, allowed me to increase that knowledge, I think, like tenfold. I mean, we're learning through kinesiology and different classes more about the body than some people ever want to know. But it's it's been great to see, again, different levels of care, from nursing home to I actually had a very great, one of my clinical experiences was in an outpatient neuro facility with some both MS and Parkinson's patients, which was, you know, interesting because they are very common diseases that probably everybody knows somebody with one of them. So it's just interesting to just to learn and just to be able to see different things when you're out and about. You can notice things about people, I guess, when you see somebody walking, or, you know, kind of pick up on things. There's so much. I can't even, you know, go into all of it, but I don't know if I even answered the question. I apologize.
No, thank you, Jen. That's excellent. How about you, Ashley and Shannon? Whoever.
Sure. I'm here. You can't see my face. I'm driving, so I apologize. So it's Ashley. I would say, you know, I think what I love so much about this field is just how many different avenues you can kind of branch off onto. So, you know, we've had people mention pediatrics and home health. You know, I'm now doing women's health. If you had asked me 10 years ago if I had wanted to do that, I would have said, oh, heck no, I don't want to do women's health. And so I just think this career is so great because as you change and you grow in your career, some of your interests might change, and you have the flexibility to go with that. So if you do say, hey, you know what, I want to branch now into pediatrics, well, you can do that. Or if I want to branch into education, well, I can do that. And it just gives you that flexibility. Or if you do have a family and you want to have a schedule that's a bit more flexible, well, maybe you'll go into home health. And so I think I love that component. And I also love the fact that you're getting people physically better, but also mentally and emotionally better, like I referenced before. So it really has a psychological component to our care, and you're getting to know the whole person and forming that relationship with them. And I think that's just something that is really unique about this line of work.
Thanks, Ashley. How about you, Shannon?
Yes, I would just love to say that I totally agree about the variety. I think that's probably one of the coolest things. I also want to agree in the fact that sometimes what you think you want to do when you're younger or when you're first starting out is not at all what you end up with loving. For instance, when I was going through my clinical rotations, one of them was in a high school, and that was my pediatric rotation. I hated it. I think my clinical instructor probably wanted to fail me. I hated it so much. I'm now pretty much a pediatric specialist, and I love it. So, you know, you just never know the twists and turns that life has for you and how that's going to impact. But it's just been a wonderful career. When I was early on, I worked for a big healthcare conglomeration that let us, they had PTs and OTs and speech therapists in outpatient, inpatient, several hospitals around Milwaukee. So I was able to pick different things. And I started choosing where I wanted to be based on how much it frightened me. And I thought, really, I need to be where I'm scared. And that's where I'll grow. And that's true. So just the variety is absolutely wonderful.
I love that, Shannon. That is really, really neat.
Can I throw in one more quick comment?
Please, Jen, yeah.
So I'm guessing that OT can probably mirror this too, but one thing that I just thought of is definitely by far the education that we do with patients. So much of what we do is patient education, and some of them don't like it, but many of them don't realize that these little tidbits, tricks, things can help them move better, feel better, that sort of thing. And so it's just, that's a very rewarding part of it too, I think, is educating patients on how they can help themselves when we're not there, I guess, and do things better.
Good point too, Jen. Yeah, very, very rewarding careers, I would think, for sure. Another question for some of you guys, of course, have spoken a little bit to it, but for our fine graduates of our programs, can you give us a little bit about where you did your fieldwork or clinicals or internship? Just like a little summary on that, please. So, Miss Jess, do you mind starting that one?
I had to find my unmute button.
Oh,
wait, which Jess? I'm sorry.
Yep.
Oh, we will do, hold on. Well, because Jessica found her unmute button. So if you don't mind, Jess, we'll let Jessica go first.
No, that's fine.
I've got that struggle. No, thank you so much.
So as you go through the program, you go through different field works. The first one that I did was I just had to go sit in the gym, and that one was kind of just getting used to people watching you look at them, because it's awkward when you, like, if you were to go to Walmart and you just stared at one person and they like realized it, it gets awkward. But then when you know that they're staring at you, so just getting used to that. And then I did my next one at Family Alliance. It was an adult day center. That was my mental health. And then from there, I was scheduled to go with, I don't even know where I was scheduled to go because I never got to go. So they had some changes and I lost my fieldwork placement. So we had to kind of scramble, and I ended up going back to Family Alliance with Ms. Vogt, the director, as my supervisor, which is quite terrifying, but I think probably one of the best things that I could do. I also had Becky as my supervisor at the other facility because I kind of went back and forth between the two facilities. If I talk too fast, tell me to slow down. And then my last one was I did a placement at, it was in the school districts, and we had 2 different school districts with 4 schools total. And I'd have to say my least favorite one was the gym, but it's all what you make it. And it's just like with work. It's, you come in, you have no clue what you're gonna do for the day, but you just, I'm gonna make something better for somebody today. And so, and even if that something for somebody is you, like you feel accomplished. I felt accomplished going through all my field works that were terrifying every single day, where I constantly felt like I have no clue what's going on or what I'm doing, but somebody will guide you in the right direction. And if you're not being guided, then you're doing the right thing. And I think that's one good thing about the program is for OTA, it gives you the opportunity to just let your wings fly, and somebody will pull you in if you're not doing very well at it.
Thank you, Jessica. Yeah, so true. Outstanding. We have an outstanding faculty all the way around. But of course, OTA being the program too. Love you all. You guys are great. Thank you, Jessica. Jess, did you want to go ahead and let us know about your experience?
This guy's gotta be quiet.
Sorry about that. Like Dr. Sass said, we are primarily at Northwestern in McHenry and Huntley. It was very awesome because I actually did clinical at both different sites, and I was on the same unit at both different sites. So it's kind of cool to see like how the different hospitals have different routines and just workflow and stuff like that. But we also did last February, March, right before COVID happened, for our critical care, we were out at St. Anthony's in Rockford, which was awesome because St. Anthony's is a little bit bigger than McHenry and Huntley, and they actually had 3 different ICUs. They have trauma burn, they have neuro, and then they have the regular medical. So that was very interesting because not only do we get to see more stuff because there's more patients, but it's a whole different patient demographic that we don't necessarily have in McHenry County. And on a side note, because we do have clinicals out at St. Anthony's, I actually did the internship over the summer between my first and second year of nursing school. And you essentially apply, you have to send all your transcripts and get letters of recommendation. You pick your top 5 departments that you would like to try working in. I did cath lab, and it's essentially the 12-week orientation that a nurse would do. And you work alongside a nurse and you're doing everything. I essentially did everything but push narcotics during that time. So it's really awesome to see different experiences, not only different hospitals, but also in different departments.
Thank you so much. And Jeannie, you were saying, I think a little bit before, that you got cut a little bit short with some of your internship.
Yeah, I actually was at Northwestern in the medical records when, I don't know if they're still, I don't think they're still there, on South Street. And we started out, it was a crazy time because they were switching everything over to Epic at the time when I got there. So talk about jumping into the fire there. But we did get cut short. We weren't able to shadow in every department that we wanted to. I was really interested in the cancer registry program, and unfortunately, because of COVID, we weren't able to go further. But we did get we were able to experience quite a number of different positions within, I guess within the HIM, is the medical records, and we went to central scheduling and different things like that. And that was really helpful, just that little bit of experience that I did have there, because no offense to anybody in central scheduling, but I know right off the bat, that's not for me after being there for like an hour and a half, just, so that, I already learned something right there in that, but that it's actually really a helpful thing. I'm so grateful that the HIM program and Allison and Chris worked so hard to work on those internships and get us into a variety of locations, because it definitely is beneficial. And you can, like I said, just the little bit of time that I was there, I was able to see something I definitely don't want to do.
That is always very helpful. Thank you so much. It is helpful to be able to knock something off, right?
Yeah.
And Jen, was there anything else that you wanted to share a little bit more about your field work?
I guess, so the 3 sites that I've been at, I was at a skilled nursing facility for my first clinical, which for us is a part-time clinical, our first one. And then my first full-time one was the outpatient neuro that I was mentioning. And I'm currently at acute, at Northwestern McHenry in acute care. So I'm only week 1, so I can't say too much about it, but
Awesome.
There's a learning curve there happening, but.
Are you nervous? Would you say, did you feel nervous going in at first, or what were your feelings?
To this current one or overall in general?
Yeah, I guess either way.
Definitely. I mean, it's definitely nerve-wracking. The way that the PTA program does it with starting with a part-time one, I think is helpful because we're there 1 day a week for most of the semester. I think it ran over 10 weeks. And so that's kind of just a nice introduction to the facility, to what you're going to be doing, and you start with some hands-on and some, you know, documentation. And then the first full-time one is, it goes a little bit faster. They're all nerve-wracking, of course, because you're, you know, depending on, it's a new situation, it's a new clinical instructor. You may be learning, you know, a new documentation. I'm learning that right now, which is different than anything I've done before. So it's nerve-wracking, but it's never been an issue as far as, you know, people dropping out or
something you just kind of acclimate to.
Yeah, with, you know, with whether it's Angela's help, whether it's, you know, the CI's help, whether it's a student who was placed in that situation before, there's, you know, there's always somebody to go to for questions for answers if you have questions.
Thank you so much. I know I'm aware that it's 7:24 right now, but we have a couple of questions that came in that I'd love to be able to get for just in general with MCC. Of course, we do have our awesome alumni group and committee. So don't forget to, for any of our students that are in school right now, no matter what, you know, taking one class and stuff will qualify you. So please make sure, keep in touch with us, because things like this that are happening, you know, you might want to benefit from, or have friends, you know, family members, neighbors that would be interested. So please don't forget about that, as well as something too, because there was a question for social clubs and things. So do you guys mind briefly saying what our student organizations are within the clubs or within the programs as well, what we have?
I'll start just because I absolutely loved the student nurse organization. I did it both years. The first year as a new nursing student, I was just a member. I'm not sure how they're handling it now, but back then we used to do tons of stuff. We were always doing outings in the community, whether it be being at different races and volunteering. We used to go to the food pantry. We do blood drives at school. Tons of different things. And then my second year, I was actually a board member. I was the secretary, and every single month we had something going on, whether it be kind of something fun that we did with each other at school, like we did Tales from the Trenches, which is when we have a bunch of nurses from years past come in and kind of tell their stories. We did clearinghouse and Christmas clearinghouse in Woodstock. And then unfortunately in spring came, things were kind of cut short, but it's a really great opportunity not only to get out there in your community and help the people and, you know, show what the nursing program is all about at MCC, which once you get accepted and you're in it, you have a lot of pride for the program. At least I feel that way. But it's also kind of nice. I think some other people are talking about getting your foot in the door in different places, like making those contacts. Because I know from experience, I mean, we talk to some of the same people every year, and they're always like, all right, when are you coming back? Okay, well, you know, I need so many people to do whatever. So you at least get your name and a face out in the community. So in the future, if you're looking for a job or just connections to find other positions in the community, you'll have that out there. And then it's just good for leadership. I mean, as a nurse, you're going to be a leader, whether you're a manager or not. So it gives you great experience to kind of take on that role and, you know, be a part. We consider it a professional program.
Thank you, Jess. And then what are the other student organizations, guys?
So we have one, the Student Association of Physical Therapist Assistant, SAPTA it's called. Since we are a new program, our class started it. The second class has now taken it over for us. We have tried to do as much as we can with, you know, limited resources and being startup. So we've done, I'm not sure if they've done a lot of volunteer stuff, but we've done some fundraisers, and again, just trying to we have a board up at MCC, trying to get things rolling and get our name out there and, you know, advocate for physical therapy, obviously. So hopefully in the years coming, it'll build up and be a little bit better. But yes, there is a student organization for PTA as well.
Thank you. And then for OTA, what is that, Becky?
We do have an OTA. It's called SOTA, S-O-T-A, Student Occupational Therapy Association. We meet twice a month, and right now, because some of the students are on campus, we are meeting on campus, but we're also Zooming the meeting for anybody that wants to join us. I think what's important, and I don't want to speak, I think, for SAPTA and for SNOW, but for at least for SOTA, you don't have to be in the program to be part of the, I see Jenn nodding her head too. You don't have to be in the program and accepted in the program to be part of those student organizations. So if it is something that you're thinking about or wanting to do, I would definitely recommend joining some of the programs for that.
Yeah, excellent advice, Becky, for sure.
I just want to jump in on that. Earlier, we were talking about exposure, getting exposure into the field. If not finding that exposure is something you can do right now, finding that exposure through the program that you want. We talked about terms we were having issues with. We talked about subjects we were having issues with. We talked about different things the community needed from the program, different things that we needed from the program. And it really helps, like, it exposes you to more, like, the context of what you're going to learn. It exposes you to what you're going to do out in the field. So I think that's another good way to get exposure into to the field that you want to go into, whether it's CNA or nursing or PTA or OTA or whichever one you go to. There's that exposure if you need it.
Thank you so much for that. Very, very true. Yeah, as much, guys, you have heard it from all of the panelists, anything you can do to just get that exposure. Don't be afraid to reach out. Speaking of reaching out too, I want to make sure, unfortunately, our time is coming to an end here. And of course, want to thank all of you for attending. And thank you so much to our panelists for your incredible information. Thank you so much to Megan and to Student Life for putting this event together. If you guys have any questions that you feel haven't been answered, or something that just comes up, please, if you want to email Student Life, and I'll go ahead and put that, or actually, Megan, if you don't mind, do you mind putting that in the chat? It's stulife@mchenry.edu. So if you have any questions, or if there was a question for the panelists, Megan and I can go ahead and sift that through to them, so that way we don't leave you with any unanswered questions. And any way we can be of help to, of course, we want to be able to do that. Again, we can't thank you all enough. And also too, just another little reminder, I saw Katie had put in the chat, please make sure again that you do that. She put in the chat to remember staying in touch. So when your career with MCC ends, please definitely go to that www.mchenry.edu/alumni. You're going to find excellent things and opportunities. And of course, the college always is doing fun things with the community, informative, educational things, and just fun things like baseball games and stuff, like with the Alumni Association. And so please make sure, stay in touch with all of us. And again, we can't thank everyone enough for coming, and you panelists are incredible. We thank you. We hope everyone has a terrific night, and thank you so much again. Actually, I'm sorry, Megan, I think you did get that up right before we would go. Right?
Yeah, I put it in there.
Perfect, thank you. I'm sorry, my little scroller doesn't want to scroll. So make sure you get that email. So again, any questions that you have, please let us know. Megan and I would be happy to make sure we get you in touch with the right people. Thank you so much, everybody. Have a great night.
Thank you, Amanda.
Thank you, Miss Megan. Thank you all.